Because I was talking to Amir about it, and we're both really passionate about enabling healthcare through access to clinical records and being able to join up the system in terms of integrating digital care records, so we can actually look at what care really means rather than just being able to measure, for me, in the ambulance service world, just 8-minute targets being the arbiter of all things quality, instead being able to really understand the rich tapestry of care.
I think initiatives like this are really helping because it brings it to the fore and it gives those who are up-and-coming leaders and innovators a platform to be able to share that. And that's what it's about really. It's about sharing best practice and great innovative ideas so we can all move forward and improve.
I basically, from an early age, I was diagnosed when I was 1 with diabetes, and ever since then I felt like there's always improvements. And I've worked for a patient organisation, Diabetes UK, for a long time, as well as the International Diabetes Federation. And I think it was through my work, working with young people, that's often sometimes not the most engaging of demographics for the NHS.
The Rising Stars were people who have risen from the ground and done things that are very innovative, that have made a real difference for patients and patient care, but also who are continuing to push things forwards and hopefully will deliver much more over the coming years.
I think initiatives like this, getting people together, is a fantastic opportunity to share good practice and innovation. And one of the things that concerns me is that we have lots of excellent things going on all over the place and not enough joining up of things. I think we have too many gaps. And if things were more joined up, then there would be an opportunity to roll out much more effectively some of the things we've heard about today.
I think it's just a transformational act on the part of the Journal and Salicio and all the sponsors, people who supported it. And what we really need to do is to get more people aware of how young managers and clinicians are making a difference and spread their stories. And I think it makes a difference because people see the art of the possible and the fact that you really can change the health service for better.
I think the NHS is about to go through a period of very big change, a lot of challenges ahead. I think there's going to be a lot more data available to patients, so they're going to know much more how the NHS functions. It may be a surprise for people. I think that they'll know how their local clinicians are doing and their local organisations and teams. The financial pressure is going to be very tough on organisations, and this is going to lead to them to need to make some very big decisions. The focus will be more on innovation, and so they're going to be keen to get frontline teams to innovate more. And so this is going to need staff to behave very differently.
It's really hard to say how the NHS is going to change over the next 5 years or so. We know that financial constraints are going to be ever greater, and we know that that in society in general there's a great trend towards greater empowerment of citizens and patients. So undoubtedly continuing to empower patients while facing financial constraint is going to be a big part of it. And I think that that really that's going to mean working in a much more collaborative way and moving away from the command and control structures that we're used to seeing.
There's an imperative to look at changing demographics in patients with ageing and chronic disease, and the NHS has got to go from a traditional model of acute care through hospitals, episodic based, to continuum of care which looks at the whole patient, which is largely ambulatory based. So I think what we'll see is a concentration of specialist services in a smaller number of places, and we'll see more and more devolvement of activity into the community to reflect the needs of patients.
I think senior management need to have more understandings of what it's like, first of all, to be a patient, first of all, what it's like to be a patient, and to perhaps have some more patient experiences, and secondly, to listen, to be prepared to listen and accept that change is inevitable, and perhaps listening more and managing less might be an idea.
I think the most important thing is to become much more patient-centred, so we focus on the needs of the patient rather than the organisation, and focus on quality, which is safety, effectiveness and patient experience, and bring safety right up to the fore. I think if we focus on quality and safety and focus on the patient rather than the organisational needs, that would really help managers, clinicians and patients.
I think we are seeing a revolution, and I think it's a great thing. I think we've seen on the back of mid-staffs some real problems for the service and real challenges, but I think what's emerging the other side is an NHS that's going to be more transparent, more facilitative of clinicians and patients and the public having a stronger say in the way the service runs, and I think they'll be absolutely at one to try and preserve something like the National Health Service, which is one of the finest innovations this country's ever had.
Up and coming rising stars need to have the courage in their convictions. Most of them are quite strong characters, that's why they're here, but I think they've got to keep pushing on through because there will be barriers and there will be challenges. But if they can just have that courage of conviction and push on through, it'd be great for the NHS and it'd be great for them individually.
But I think it's understandable that sometimes people get a bit disillusioned and a bit downhearted when change doesn't happen quickly. Obviously change does take time, things are not going to happen overnight, so I think people just have to be focused on what it is they're trying to do, have courage to stick with it, and I'm sure with time those changes and developments will happen, and we can all support each other in the process, which is, again is what's happening with this event today.
Well, it was great to see so many people here and so engaged in the whole process, and looking around at just some of the output from the interactive session, from the table discussions. It seems there's a lot of consistency around the need for change, innovation, devolution of accountability and responsibility, and so again I think that what it's done is brought together a key group of people and shown them that there are shared learning, shared problems, but really that there is a way forward here.